Okay, everyone, so we've got the brand new laser this week. This is the Showerhead MR5 Active Pro by Multi Radiance. People are always asking me what lasers should they get. We had a patient come in earlier. He spent $280 on a laser, and I don't know what he got. You know, $280 you're probably going to get not much. Just to kind of put it in perspective, this is a $15,000 laser. Okay, we have this one and we have another one that's a little bit more advanced, but what we're going to do is use this on his neck. He has a sore neck. This can be used for trigger points across the top of the shoulder, torn rotator cuff muscles, disc herniations in the neck. It's got so many applications, and what we're going to do is just focus on reducing the pain, inflammation, and muscle spasms for him. So where is it sore, right or left side?
Both sides.
Both sides, okay. So on a scale of 1 to 5, 5 being the most sensitive or sore, what would you say that is?
3.
3, okay. And that?
Yeah, that hurts too.
That is that a 3 or
3.
a 3 also? Okay. And here?
Here is 4.
A 4, okay. So we're going to go over the 4 first, and then we'll test it right afterwards. So this is a great laser because the Showerhead allows me to treat larger areas, the legs, the back, the neck, the spine, and treat a larger surface area much quicker. And I have another laser very similar to this, high power laser, and that one, same thing, but it doesn't have the big shower head, right? The aperture is about a fifth of the size. So it takes longer to treat the different areas depending on the injury. This, I can treat a larger surface area much quicker. So it's been a huge addition to the practice, and you're gonna see what this does. So he called that a 4 out of 5. So that's pretty high as far as pain levels, that trigger point that I pressed. And we're gonna check it again here in just another minute. And it's pretty boring, as you can see, but what laser does is just incredible. It excites the mitochondria. It has so many physiological effects in the body, from the sodium potassium pump to the mitochondria, exciting the mitochondria. It can down-regulate them as well, or stimulate them. It just does so much based on the frequencies. You need to know how to use these lasers, so a lot of people are buying them on Amazon and just pointing and not really knowing what they're doing. So that matters. That makes a big difference, and so does the laser itself. So if you bought a laser on Amazon or something like that, you're probably not gonna get great results. If you did, awesome, love it. How about that? Is that a 4 still?
No.
What is that on a 1 to 5?
2.
A 2. So it went down from a 4 to a 2. Now over here, you had a 3, right? Okay, so we're gonna do that one next. Okay, so yeah, again, if you had results, even if it's in your head, great. You know, seriously, I mean, whatever gets you well, whatever gets you better. But a lot of those lasers you'll find on Amazon and wherever on the internet that are a couple $100, they're probably just like infrared or just red light therapy. So this has all of those lasers and laser diodes higher, like 900 plus nanometer. So those cheaper ones don't have that laser. So it's not gonna do any tissue repairing and healing. It's just gonna help maybe with some inflammation or pain, maybe. And it depends on the laser. Is it super pulsed or not? I really like super pulsed lasers, especially for the layperson, even better, because you don't wanna overdose or overheat the tissue, right? So one big thing is more is not better, okay? In this situation, less is better. And then 6-7 hours later, if you want to laser again or treat that area again, you can, but you don't want to overdose the area. You're not helping yourself when you do that, okay? You're negating the effect of the laser. So again, more is not necessarily better, meaning the longer the treatment time doesn't necessarily mean that that's better, okay? And that's for the practitioner to know exactly how much time to spend on that area and treat and dose that particular area. And we've got 20 seconds left for him, and then we're gonna test that trigger point. And then we're done with the right side, and we're gonna do the same thing on the left side. Okay, ready? And how's that? What is that on a scale of 1 to 10? 1 to 5, sorry.
1.
A 1. So this one went from a 4 to a 2 in 2 minutes, and this one went from a 3 to a 1. And how are we doing over here?
We use like, 2.
A 2, okay. And here?
Not two.
A 2, a 2 and a 2. Okay, so this side's a little better. And that's pretty much it. So if you guys have any questions about lasers, you could certainly comment below. If you live in New York City, we rent these as well. So that's a possibility. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.